Hello everyone, my name is Sachin Desh. Today we have Dr. Prashant Chandra. He is a surgical oncologist, a well-renowned surgical oncologist in Pune. He is working at TGH Onco-Life Cancer Center, Talegaon. He's going to talk about cancer, surgeries, and many other things pertaining to cancer. Hello, Dr. Prashant Chandra. Before we start the podcast, can you tell us something about yourself, your academic and your professional journey?
So I'm Dr. Prashant Chandra. I'm consultant surgical oncologist at TGH Onco-Life, Talegaon, Pune. I did my MBBS from Pune, BJ Medical College. I did my DNB General Surgery from Pune Hospital and DRNB Surgical Oncology from Ruby Hall Clinic. I did my FMAS DMAS from World Laparoscopy Hospital. 2 years I was senior registrar in Lex Budhrani Hospital, and I was assistant professor in surgical oncology in DY Patil Medical College for 2 years. And then after that, I got a post of consultant surgical oncologist at TGH Oncolife.
So let us talk about cancer. What exactly is cancer? And to our general public, can you explain in very simplest of the terms?
So, see, our body consists of tiny living entities, what we call cell. These cells, they function in a very coordinated manner. Our body signal them to grow, multiply, and then when our body signal them, they stop growing. And they serve some function of the body. Now, these cancer cells, they are different from these normal cells. They do not follow any signals. They don't do any function. They just keep on eating food of other cells, and the biggest problem of these cells is they don't follow any boundary. They break their boundary and they just roam freely inside the body. So these are the characteristics of a cancer cell.
So can you tell us something about PET, also known as PET CT scan? Why is it considered as a gold standard in the current age for cancer detection amongst the patients compared to the CT scan?
Sir, as I told you just now, that these cancer cells, they have a tendency to eat others' food. So basically, they uptake a lot of glucose. Now, in PET scan, what we do is a radionuclide is tagged to this glucose. So wherever cancer cells are there, there will be high uptake of FTG glucose, which is actually tagged to a radionuclide. So these PET scans, they show us wherever we have cancer cells in the body. Now, over a conventional CT scan will show you a lump. This may be cancer, maybe benign, maybe fibrosis or anything. But PET scan will show you if it is taking up a lot of glucose. If it is taking a lot of glucose, it is cancer cell.
So can you explain to us what is FDG?
Sir, FDG stands for fluorodeoxyglucose. So the fluoro part, it is actually a radionuclide, and it is tagged to a glucose whose oxygen is removed. That's why we call it deoxy. So this glucose, this acts like a normal glucose. It is taken up by a normal cancer cell, but when it goes inside the cancer cell, the new radionuclides start emitting signals, and these signals are picked up by the PET scan.
So you're saying with the help of PET CT scan, we can actually see if the cancer cell is malignant or not. Is that?
Yes, sir. Actually, I'll say PET CT is not 100%, but it is highly accurate, with a high accuracy. It can tell us whether the cancer has spread throughout the body. So it is a very good tool for staging the cancers.
So now tell me about biopsy. Why is biopsy so important for cancer detection?
So basically, biopsy is taking a bit of tissue or a piece of flesh, and we check it under microscope. Once we see under microscope, definitely we know whether it is a cancer cell or not. So I'll say biopsy is gold standard for diagnosing a cancer. Actually, except for few cases where we are directly going to operate, biopsy is required before taking any cancer treatment, because it not only tells us the diagnosis, it tells us whether it is cancerous or not, it also tells us the biology of the cancer, what treatment will fit better for this particular cancer. That's why biopsy is very, very necessary before starting treatment.
And in India, what is the price range of biopsy?
Sir, usually, from taking biopsy to the pathology cost, it ranges from 4,000 to up to 20,000, depending upon how the biopsy has been taken. Either it can be taken directly in a OPD procedure or using CT scan or a USG guided biopsy. And also, the test report is not just by looking under the microscope. Sometimes we require IHC and these markers, so the cost may vary, but usually from 4,000 to 20,000 it ranges.
Also, so I wanted to ask, is biopsy painful?
Sir, usually we use local anesthesia for biopsy. I'll say it is not painful, but yes, patient do experience some discomfort, but usually it is a painless procedure.
I just wanted to understand how important is surgical oncology for a cancer treatment. Also, I wanted to ask, amongst 100 patients, how many patients have to undergo surgical oncology during their treatment journey?
Sir, by logic, if you see, surgery will remove the cancer. So I'll say, except for blood cancers, all other cancer, if we are going with curative approach, we have to do surgery at some point of the time, some point in the duration of the treatment. But then, yes, I'll also agree that few cancers we have stopped doing surgery, like cancer of voice box and cancer of anal canal, because here surgery can cause the patient to lose its voice, or there will be a bag where the patient will be passing its motion. Except for these two cancers, all other cancers, at some point in the treatment, we have to do surgery.
So, can you tell us something about non malignant, which is also known as non cancerous tumors? Do those people have to undergo surgery?
So, frankly speaking, in non malignant or non cancerous tumors, surgery is the only treatment. Many times, patients come to me and they ask that, sir, this is not cancer, you told me. So, can a medicine melt it? So, frankly speaking, chemotherapy can melt or at least shrink a cancer. Radiation can burn a cancer. But for benign tumors, the only treatment that is left is surgery. But then, surgery is optional. Like, suppose someone has got a lump of fat in somewhere in the body, there the surgery is totally cosmetic. But suppose someone has got a lump in the intestine and that is causing obstruction to the food passage, in that case surgery is mandatory to relieve the obstruction. So I'll say in benign cases surgery is optional, but it is the only available treatment.
So, also, I just wanted to ask, out of curiosity, do these non malignant cancers can they turn into a
Yes, sir.
malignancy?
There are certain like adenomas, they have a propensity to convert to carcinoma or cancer.
Now that the medical field is growing and there are so many technological advancements which have come, I'm sure in surgery there is a technological advancement which is also known as minimal invasive surgery. Can you please tell us how it can impact a person's quality of life?
Sir, as you rightly said, that in medical field there are lot of advancement happening. In chemotherapy, from chemotherapy we came to targeted therapy. In radiation, from 3D CRT, now we have come to IGRT and tomotherapy. Similarly, there has been advancement in surgical techniques also. So nowadays for surgery we are using minimal invasive technique. Basically, I just want all listeners to understand that whenever we get a pain, the pain nerves, they are present in skin and underlying layers. There are no pain nerves in organs, in inner organs. So when we are doing a surgery with a huge cut, so we are giving pain to this patient after surgery. But when we are making small cuts on the abdomen, what we do in laparoscopic and robotic surgeries, so the pain amount given to this patient after surgery is very less. Now the benefit of this is that soon after surgery, patient is pain free, patient sits up, patient starts walking, patient starts eating, this patient gets an early recovery. Due to early recovery, this patient goes for further treatment, might be chemotherapy or radiotherapy early. So not only this patient is getting a good quality of life, but also a good oncological or cancer related benefit by resuming the adjuvant therapy early.
So there is an interesting concept that I've heard and that I've seen in TGH Onco-Life as well. One that is called a short stay surgery, wherein I believe a person who has undergone breast cancer treatment on the same day they get discharged. So how does that work?
Yes, sir. For some superficial surgeries like breast surgery or thyroid surgery, uh, we tend to discharge these patients very early. I mean, if possible, on the same day. So once the patient is awake and patient has started eating, we ask this patient to go home. This, on one hand, this is budget friendly also, and on other hand, this prevents patient from getting exposed to infections by other hospitalized patients.
So in such surgery, how long does it take for the person to lead a normal routine life? Like how when can they go to the hospital? When can they work out or something like that?
So usually these are superficial surgeries, so there are no restriction to movements or any routine activity. Usually we ask the patient to rest on the day of surgery and maybe the next day, because the effect of anesthesia is still there. But once patient is fully awake, patient is moving, eating, then we ask patient to slowly resume their daily routine activities.
Sir, in TGH Oncolife Cancer Center, we have the government scheme, the Mahatma Jyotirao Phule Jan Arogya Yojana scheme, which benefits all the people with all the ration cards, be it yellow, orange, white, so that they can get treatment free of cost under that scheme. I just wanted to understand, does laparoscopy or a plastic surgery, which is reconstruction surgery, included in that package?
Actually, yeah, sir. MJPJY they cover various surgeries, but laparoscopic surgeries and reconstruction surgeries are not covered under MJPJY. Now, actually, I agree that the main purpose of doing a surgery is to remove cancer. But suppose in a patient of mouth cancer, we have done a resection, and after that, this patient should be able to swallow. This patient should have confidence to talk to others, should have confidence to show his face. But since reconstruction surgeries are not covered, then there we lack, I mean, in the post-operative period. Similarly, for laparoscopic surgeries, if we do a laparoscopic surgery, the recovery will be early, the patient will resume routine life activities early, and then will be able to go for adjuvant therapy. But since they are not covered under government scheme, patients are deprived of that.
When a patient has been detected with cancer and they have been advised to undergo surgery, now we know there are some big institutes where the waiting time is months because of the number of patients that they have. So sometimes they have to wait for 2 months, 3 months, 1 month before undergoing surgery. How long do you think the patient should ideally wait before there's any change in the body? How much time do you think, like how soon should they get the surgery done for the best of the benefits?
Sir, I believe the moment cancer is diagnosed in a patient should get indulged into the preparation for surgery, because the cancer, the tumor is growing inside this patient. And as I told you, these tumors, they tend to break their boundary and spread in the body. So actually, we don't have much time. Usually, I tell my patients that after we do a scan, if 1 month has lapsed and surgery has not been done, we should repeat a scan, because the surgical plan may change. Many a times I have observed that if we have a scan more than 1 month, when we go inside for the surgery, the disease is actually enlarged. It has the stage has changed, and we have to change the plan for the surgery. So ideally, we should not wait more than 2 weeks. If still we have to wait, 1 month should be the cutoff.
So after the treatment, the patient has to do a follow-up. It could be 1 month, 3 months, 6 months, whatever the schedule is decided. For some instance, the patient is not doing regular follow-up. So what are the negative effects of it?
Sir, usually after completion of treatment, all cancer patients we call them for follow-up. The thing is that the chances of the cancer coming back, what we call recurrence, is highest during first 5 years, and in that also it is highest during first 2 years. So during first 2 years, the follow-up is very stringent. Probably we call patients monthly or 3 monthly for some kind of follow-up. Now the thing is that our aim is to do some tests, to do some scan, and try to detect the recurrence in an early stage, so that we can try to do some curative intervention for them. Suppose a patient, due to some socioeconomic problem or some reason, is not able to do this follow-up, this patient will come back to us when the symptoms start. And frankly saying, if symptoms have started, the disease would have progressed to a stage where curative treatment may not be possible, or even the benefit of treatment is questionable at that time. So that's why we usually ask our patient to be punctual in their follow-ups.
So do you come across such patients who do not regularly do the follow-up in spite of you?
Yes, so this is very common in our Indian scenario, where patients are coming from far-flung areas. So these patients, they miss their follow-ups, and when they get symptoms, even they sit with their symptom, they tend not to come, because they don't want to disturb their family members or their routine life. But by the time they come to us, the disease has progressed to a extent that we cannot help these patients at that time.
So in these patients, is there an attitude that my treatment is done, my cancer is over, now why do I have to go for the follow-up? Is that the case?
Yes, sir, this do happens. I mean, once we tell them that your treatment is complete, their ears close at this moment. They don't hear that we are asking them to come back for follow-up. Actually, we don't tell them that your treatment is complete. We tell them that it is going to take some time. You have to come for follow-up, maybe 5 years, 10 years, and only then we are going to declare you cancer-free. But the problem is that once we tell them that there is no more treatment required, they stop following with us.
So there is this one concept that is the 5 year rule, wherein the recurrence should, they say that the recurrence should not happen in 5 years. That is when you're cancer free. How true is that?
So see, the thing is that these cancer cells, they are multiplying using a geometric progression. So once we have done a treatment, we presume that there is no more cancer cells remaining in this patient. In such patient, there should not be any recurrence. But suppose one or two cells are remaining, we presume that with their geometric progression, within 5 years, it will progress, it will come in some scan or will produce some symptoms. So we tend to tell patients that chances of recurrence is highest during these 5 years. And in that also, within the first 2 years, it is highest. So if a patient doesn't get a cancer back within 5 years, the chances, obviously this depends on the biology of the tumor and the treatment that patient has received, but chances that after 5 years the cancer will come back is less than 5%.
Can you tell us which are the cancers with the right treatment approach which are totally curable?
So I'll say all cancers, if detected in the early stage and treated properly, they are curable. But then there are certain cancers like thyroid cancer or breast cancer, even in stage 4, when they have spread throughout the body, they can be cured. Not just treated, they can be cured. But obviously, their biology and the extent of their spread, it determines whether they'll be curable. But I'll say that early detection within stage 1 or 2, all cancers can be cured by right treatment.
So many times we have heard and seen that the post surgery treatment, the recovery of the patients is relatively slower than anticipated. So, for the patients, what advice can you give for them to recover quickly and in a more smoother fashion?
Sir, thing is that surgery is a physical trauma. So until unless the healing is going to be there, the patient won't be able to sit, walk, eat, and everything. But thing is that there is the psychology plays a very important role in this. I tell my patients, if you are getting pain, let me know. I'll give you adequate painkillers, but I want you to sit, I want you to walk, and I want you to start eating, at least start drinking. So my advice to all my patients is that bear some pain. I'll give you painkiller. Don't worry about pain, but please get up. Patients are usually scared that if I'll get up, my stitches will break, something will happen to my internal organs. But we take very good stitches. Don't worry about it. You just sit, start walking, start eating, and let the nature take care of its healing.
So, you're saying basically the willpower and the positive attitude plays a very important role.
Yes, sir, absolutely. The patient should be ready to, get out of the bed, start walking, and positive attitude is actually very important.
So, during the treatment journey, how important it is for the patient to have a very positive mindset? Can it lead to a difference between life and death?
So, frankly speaking, there is no scientific study that proves that patients with positive mindset they will do good. Their cancer will be treated in a better way. But I can challenge you all over the globes. All oncologists will agree with this that those patients who have very positive mindset, they usually do not get recurrences. And those who are nagging, crying about their problems, they usually get a recurrence. Despite having a good biology disease, despite getting a good treatment, they usually get recurrences. The reason behind this is not known. We don't know the science. Maybe it's the immunity which kills the cancer. But then patients with positive attitude, they actually fare well.
So, like for example, like in our hospitals, TGH, Onco-Life, where we have natural light, where we have a very conducive environment, a very positive environment, how important does the hospital environment role also play in the?
Sir, I will say ambience where the patient is staying, that is very important. Yeah, natural light actually leads to melatonin production and that gives a boost to the immunity, the stress level is low, and all this actually help in healing, help in patient fighting the cancer, the immunity which is fighting against the cancer. So ambience and the surrounding actually plays a very good, very important role in cancer cure.
So, can you tell me one incident where the patient or the relative has asked you the most absurd question?
I'll tell you a funny story. This was a 25-year-old, maybe a software engineer. So he came to my OPD and he asked me, Doctor, 2 weeks back I cremated my grandmother. She was suffering from breast cancer. She died of breast cancer. So, what are the chances that I may also get a cancer? I actually wanted to tell him that, see, there is a hereditary basis. You may get a cancer, but not because you cremated. But this guy doesn't let me speak only. He continued. He said, Doctor, the fumes were coming to my nose, although I tried to cover it with mask, but the mask was coming down. So the fumes might be carrying some cancer cell. Can I get cancer, lung cancer due to that? Then he continued. He said, I even touched the ashes with my hands. I should have worn a rubber gloves. Can I get a skin cancer? So I just wanted to tell him, stop, be calm. See, you have burned the cancer cells along with your grandmother. You cannot get a cancer by fumes or by touching the ashes. And before I can answer him, he was not letting me answer also. And me and my assistant, we just kept on laughing. I tried to control my laugh because it's not good to judge people. It's obedient. They can have questions. They are lay people. But then this was really absurd question that can he get cancer due to cremation?
That's true, sir. Actually, even we have seen some patients like these where they have no knowledge about cancer. They have no awareness about cancer. Like one incident in I'd like to share where the patient comes with his mother and he tells us that since his mother has been detected with cancer, the people in the villages have stopped passing through that road thinking that they'll also get cancer through airborne or something like that. So they had asked them to leave the village, and this was just 5 years back.
It's very unfortunate. I mean, this should not be a social stigma. People should understand cancer does not spread like an infection. It's not an infection. It's someone's cells, body cells. They cannot be transferred to others' body.
So I know it's a very serious environment in Operation Theatre, but can you just tell us one funny incident that happened in your OT?
I can remember this was not inside my operation theater, but in my pre-operative setting. See, first of all, I would like to tell all the listeners that breast cancer, although it happens in females, it can also happen in males. It can happen in men also. So once I posted a breast cancer patient for mastectomy in my OT. So first of all, my OT people, they were surprised how he's doing a mastectomy. He's such a proponent of breast conservation. Then they found that the patient's name, it's a male patient. They were all surprised. Usually my OT staff, what they do is they prepare a checklist. They check everything that wrong surgery is not being done on a wrong patient, wrong site. After they check everything, they call me. I go to OT, cross check everything, and I start the case. So that day, I didn't get a call from my OT. Everyone was puzzled. Everyone was thinking how a male patient is coming for a mastectomy, for a breast cancer surgery. So people didn't take this patient inside the OT. I'll tell you the funniest part. One of my OT technician, he was just thinking there's something wrong with this patient. He went and checked genitals of this patient. He wanted to make sure it's not a female pretending as a male. So when I went up, I saw that they're not taking the patient inside operation theater. Then I told them, see, I'm going to do mastectomy in this male patient who is suffering from breast cancer. And I told my OT technician that instead of checking the genitals, you should have checked the breast. There is a large tumor there. But I'm happy with my OT staff that they took a precaution. Instead of doing a wrong surgery on wrong patient, they stopped the procedure. But this was better. I mean, better than doing a mistake. But this was actually funny, especially what this OT technician did.
Sir, in our industry, there is a famous saying that Budapa Bikta hai, especially for the doctors. Now, you look like a very relatively younger surgeon and you have been practicing for so many years. Have you ever felt any discrimination by the patients or the relatives, like the lack of confidence that he's so young? How can he perform the surgery on me? Will it be successful? Have you ever faced that?
See, sir, surgery is a skill-based job. So obviously skill comes with age. But then I'll say that yes, since 15 years I'm in this branch, I have been doing many things. But yes, sometimes what happened that I'm trying to tell a patient that see, this surgery cannot be performed on your patient. It's an advanced disease. It's a metastatic disease. At that time, sometimes patient asks me, should we take opinion from a senior surgeon? Or why don't you take help from a senior surgeon? Now, actually, I cannot help them. I cannot make them believe that, see, what I am saying is what others are also going to say. This is the best treatment. Your patient cannot tolerate this surgery, or the patient will not be benefited from this surgery. And sir, I'll say, leave apart about the patients. There is one of my colleague, he's 3 years junior to me, but he's bald and he has got a very big belly. So he looks much senior than me. So whenever we go to any social gathering or a party, we are surrounded by many people asking many questions. So he get all the serious questions and I get all the futile questions. But I actually enjoy it. And sometimes I start calling him sir and I say, sir, I'll assist you in this surgery. I'll assist you there. And it's actually funny looking expressions at his face. But jokes apart, yes, this is the problem with our society. This is the paradox with our society. People think that experienced people are going to be older. Frankly telling you, in surgery, older people, their hands are shaking. They may not be able to do the skillful job. I mean, they can give you a good decision, but not a skillful job. This is the job of a relatively fit person. Especially for laparoscopic surgery, a person who can stand for a long time is a better suit.
So now there are many senior surgeons, who are relatively old but also very famous. Like they are well known all throughout. And I've heard that in their hospital or in their setting, they are doing 7 to 8 surgeries a day. Do you think that's humanly possible? Are they actually doing all those surgeries?
So, frankly speaking, before coming here, even I used to work under someone. I'll tell you the reality behind this. Thing is that no one can perform 7 to 8 surgeries within a day. What is actually done in these setups is 4 patients or say even 8 patients are taken simultaneously in the OT. The assistant surgeons, they start doing the surgery. Wherever there is a critical step or some help is required, they call the senior surgeon. And the very small part, say some half an hour part, is done by the senior surgeon. Rest of the surgery is being performed by assistant surgeons. I mean, this is the black reality behind these famous names. Also, sir, I'll tell you one thing. Many a times, these older surgeons, they're not fit enough to stand for a long time. They're not fit to perform the skillful jobs. They have well trained their assistants and they are actually performing the surgery. But the thing is that patient go in these famous faces, they go in name of these famous people, and they are happy because the job is done.
Correct, sir. But in this case, what I would also like to add is that they have trained their people so well that they are confident. Because again, if I feel that the surgery is not done right, the patient is going to blame the famous surgeon.
True, sir.
So somewhere that is there, but again, the patient is not being given the right information as to or the reality of who's actually going to perform the surgery.
I agree, sir, that I mean, whichever surgeon, the senior surgeon, he has trained his assistants, he has confidence in his assistants. But it is wrong somewhere. We are hiding the information from the patient. But then what these people say is, patient is happy, leave it apart.
So, before we conclude this podcast, I just wanted you to give some word of advice to our viewers pertaining to cancer.
Sir, as I tell all my patients, cancer is just a word. Don't take it like a death sentence. And please do come to us. We will help you and let us be a part of your battle against the cancer. So thank you so much for calling me on this podcast.